Good evening, everyone, and welcome to today's wonderful evening with Dr. Murali Bharadwaj. 50 full-scale NEETPG mock tests. Already we finished 11 NEETPG mock test discussions. Every mock test, I give the PDF in the WhatsApp study group. Before coming to the test, take the test, download the PDF, take the test, share it with few friends. All of you sit together, solve the paper with a timer, and then come for the discussion. And there are 200 mind maps of explanatory answers. Each mind map consolidates all the high yield facts about that particular topic of the MCQ. There will be 35 to 40 image based questions in each mock test. So once you solve this 50 full scale mock test, you are solving 10,000 MCQs and 50,000 high yield facts, almost 2,500 image based questions you are practicing. That's more than enough for you to become the topper in the tomorrow's NEETPG doctor. So let's make the great beginning. And can the online students can punch? Is the voice loud and clear for all of you, doctor? So yes. So once you go to the learnograph.com and download the PDF, you have the PDF in which there is a schedule, then there is a PDF of the question paper. Solve the paper before you come to the discussion. It will be very, very interesting. And it has 30 to 40 image-based MCQs, clinical vignette, case-based MCQs, straight liners, all this, just like the actual entrance exam. There will be 100% strike rate in the tomorrow's NEETPG from these 50 NEETPG mock tests. So once you solve the question paper and join the discussion, there are all the explanatory answers in the PDF that you can download from learnograph.com in the form of the mind maps, which will give you the key points about each topic. So with that preamble, let's make the great beginning, doctor. Yeah. Now, a patient presents with brachycephaly, exophthalmos, beaked nose, and a mid-face hypoplasia. Genetic testing reveals a mutation of FGFR2 gene. What is the likely diagnosis? This is called Cruzon syndrome. Craniosynostosis, distinctive facial feature like a beaked nose. Mid-facial hypoplasia. Along with the FGFR2 gene mutation, the combination is called Cruzon syndrome. You need to differentiate this from Eppert. Eppert syndrome also has syndactyly. That's what you need to basically remember. Now, doctor. A young girl presents with craniosynostosis, complex syndactyly in both the hands and feet, along with FGFR2 gene defect. Then that is called the Eppert syndrome. Eppert syndrome is what you have to remember. 44-year-old male with the features which are being shown in the figure. A CT scan shows anterior cranial fossa fracture, right? So what is this finding called? This is called Panda's sign. So what is Panda's sign, doctor? Bilateral periorbital ecchymosis. Bilateral periorbital ecchymosis is called the Panda's sign, is what you have to remember. So Can the online students can punch? Is the voice loud and clear for all the doctor? Very nice to see 7 online classmates. Very good, doctor. Very good. Very happy to see you all. Good. Thank you, JJ Singh, for the feedback. Voice is loud and clear. Good. Now, so Panda's sign is periorbital ecchymosis in anterocranial anterior fossa fracture, especially with the trauma to the frontal area, is what you need to remember. Now, a patient presents with the history of the head trauma. After that, there was a period of alertness, which is also called the lucid interval. And a CT scan is being shown to you. What do you see, doctor? Biconvex shaped bleed, which is the extradural hemorrhage, is what you should remember. A patient with recent history of head trauma with progressive drowsiness, worsening headache, and what you are able to see here, typically a semi-lunar shaped, crescentic shaped hemorrhage, which is characteristic of acute subdural hematoma, is what you need to basically remember. Right? Now, a child with a history of recent ear infection with fever, pronounced swelling, and there is a redness behind the ear, which is classical of acute mastoiditis. And what is this called? Bat ear appearance is very classical. A patient presents with a history of persistent eye discharge. You are able to see a white mass. White mass is observed during otoscopy on the tympanic membrane. So this is a case of chronic suppurative otitis media with cholesteatoma is what you are able to see here, otoscopic appearance. Patient has a history of recurrent ear infections. Otoscopic appearance typically is that of the CSOM with tympanosclerosis. This is the typical otoscopic appearance. A patient has got a pulsatile tinnitus. Very nice to see 5 online classmates. Pulsatile tinnitus with conductive hearing loss in the right ear. Otoscopic examination is being shown to you. So, what do you see on the otoscopic examination? Vascular reddish blue mass behind an intact tympanic membrane with a pulsatile tinnitus is very characteristic of glomus tympanicum. So all the clinical features, etiology, treatment about the glomus tympanicum is being given to you in one single mind map for you to master. Now, 11-year-old girl with facial asymmetry, small malformed right ear, and a fatty growth near the limbus. Fatty growth near the limbus. So it is called the golden horse syndrome. So whenever there is facial asymmetry, right, doctor? Facial asymmetry, malformed ear, and a lipodermoid near the eye, that is indicative of golden horse syndrome. It is because of the anomalies derived from the first and second bronchial arches affecting the development of the ears is what you have to basically remember. Right? Now, a child has a noticeable painless bump, is what you can see, a painless bump in the upper eyelid that is persisting for a few weeks. So this is a meibomian gland cyst, which is also called chalagion. is what you should remember. A patient presents with the intense eye pain, reduced vision, cloudy discharge after a corneal tear, right? So, what are you able to see, doctor? Whenever you are doing the, whenever you see there is a collection of the pus in the anterior chamber, right? So that is endophthalmitis because of the corneal tear. Corneal tear is what you are able to see classically. And hypopyon, which is the visible collection of the pus in the anterior chamber of the eye, is very characteristic of the endophthalmitis, is what you have to remember. A patient presents with difficulty in swallowing, regurgitation of undigested food, frequent coughing after the meals. What is this appearance, doctor? Barium meal. It is a pouch which is called juncus diverticulum. Juncus diverticulum is what you have to remember. 42-year-old, sensation of fullness, and oral examination is done. There is no clear-cut external swelling. Sensation of fullness is there. Bulge of the tonsillar region. Bulge in the tonsillar region is there. And typically it is a mass in the deep lobe of the parotid. So it can extend into parapharyngeal space. And that is the reason, because of its extension into parapharyngeal space, it looks like a bulge in the tonsillar area, is what you have to basically remember. So now, doctor, a 15-year-old boy presents with a soft, non-painful swelling in his neck that is enlarged during the meals. There is a bluish swelling in the floor of the mouth. So what is that called as? It is called as a plunging granula. So whenever there is a mucus which is escaping after a rupture of a salivary gland duct, there is an accumulation beneath the mylohyoid muscle, presenting with both the oral and cervical components, and the oral component presents like a bluish mass. That is the nature of the plunging granula, is what you have to basically remember. Now, doctor, a patient is diagnosed with a type of leukemia. Flow cytometry. You can see the flow cytometric analysis, right? CD33, CD34. So, undifferentiated myeloblasts. These are all what? Undifferentiated myeloblasts in the bone marrow, which are expressing CD34 and CD33 on the flow cytometry. And a partial expression of CD33 and CD15 is being shown. So, it doesn't have any expression of CD64 at all. So all this is in the favor of acute myeloid leukemia without maturation. In the French, American, British system, it is called M1 type. It is less than 10% of cells showing any significant maturation into more differentiated myeloid cells, is what you need to remember. So now, doctor, a 32-year-old woman, fatigue, jaundice, dark urine, low hemoglobin, elevated reti count, and indirect hyperbilirubinemia, and a bone marrow biopsy is showing hyperplasia of the erythroid precursors, which is very characteristic feature whenever there is any hemolytic anemia. Hemolytic anemia, what will bone marrow will do whenever there is a hemolysis of the RBCs produced on the bone marrow? The bone marrow will try to show the response in the form of erythroid hyperplasia. And also there will be a brisk reticulocytosis, 7%, 8%. Reticulocytosis with anemia is equal to hemolytic anemia, because bone marrow is trying to respond to the peripheral hemolysis, is what you need to remember. Now, 27-year-old typically has cramps and tingling in her extremities. You are able to see the carpopedal spasm. And what is this called? Proteose sign. Proteose sign is the feature of hypocalcemia, is what you need to remember. A newborn typically exhibits the feature which is being shown to you. What is this, doctor? This is Erb's palsy. Erb's palsy, where there is a medially rotated wrist flexed and the arm held close to the body, typical of Erb's palsy, because the upper brachial plexus injury of C5 and C6 is what you need to remember. A 72-year-old male with a history of smoking presents with increased difficulty in breathing with a typical barrel-shaped chest, which is very characteristically seen in COPD patients. 68-year-old, easy bruising, frequent infections, bone marrow biopsy has been done. The presence of megakaryocytes with multiple nuclei in the bone marrow is indicative of dysplastic changes which are typical of myelodysplastic syndrome. Just like cervical dysplasia precedes cervical cancer, bronchopulmonary dysplasia precedes bronchogenic cancer. Dysplasia is a precancerous condition. So, myelodysplasia is precancerous before the development of the myeloid leukemia, is what you need to remember. So, typically it is a myelodysplastic syndrome, is what you need to remember. If you did this question wrong, once more, you need to go back to the textbook, whichever book, Davidson, Harrison, some son, some of the sons, any son doesn't matter. Any notes doesn't matter. Are you able to reproduce in the tomorrow's NEETPG? If you look at the 2023 NEETPG, 56 MCQs were all image based. Actually, image based are very easy to crack, provided you know a bit of funda. So what do you see here? A cord-like thickening. Can you see, doctor? A cord-like thickening, which is thrombophlebitis, superficial thrombophlebitis, very painful. Mondor's disease is what you need to remember. 45-year-old women, ovarian mass, surgical resection done. There is also a benign cystic teratoma. Benign cystic teratoma. So, what is this tumor called? Brenner's tumor. Brenner's tumor. It is a benign ovarian neoplasm. Solid growth with transitional cells, which are like the uroepithelial cells. Ravinder Singh, पंजाब का शेर और हमारा 2024 में topper in making. Always happy to see Ravinder Singh and many more, all of you. So please do come. अभी हमारे पास 50 दिन का समय available है. Golden time, you can do miracles. What you need is, one of the students asked today, sir, exam नजदीक आ रहा है, टेंशन लग रहा है, क्या पढ़ना क्या नहीं पढ़ना, कैसे समराइज करना, डर लग रहा है एग्जाम का, क्या करना. देखो मेरे भाई, जहां ज्ञान होता है, where the knowledge is there, we should be free from fear. So Rabindranath Tagore wrote a poem, where the knowledge leads me from the darkness of ignorance into the light. That is the place, oh God, lead me. Right? So nice to see Anita, very nice. So Anita, Ravinder, JJ, you're all my hope for 2024. Don't prepare for yourself, prepare for me. If a fresher just now finished internship got top rank, वो बड़ी बात नहीं है. But someone who is working in the government service with so much of pressure and attempting second or third time gets in top 1000, it's like a personal gold medal to me. So I told that student very clearly, who was afraid, क्या करना है? So this 50 full-scale mock tests containing totally 10,000 MCQs, 50,000 field facts, almost 2,000 image-based questions, and remaining clinical vignette-based questions, more than enough for you to become a topper. You don't need anything else, provided you stick to this, right? Every mind map in the explanatory answer has all the important points that you need to revise. What more do you need? Only thing is, take the test like a test and then sit with 2-3 friends, no problem. You share the PDF that you have downloaded, the ebook from learnograph.com. Share it with another 20 friends also, no problem. But all of you sit, solve the paper like a real NEETPG exam, whatever be your level of preparation. And then out of 200, identify 70, 80 topics which you wanted to improve, like leukemia, multiple myeloma, etc., etc. And then you do the discussion, and then come for the live discussion on the YouTube. You do that with all the 50 papers. अगर सीट नहीं आए तो हम मुरली भरद्वाज का नाम बदल देंगे, ठीक है? So that should be the challenge, doctor. Life without challenge में मजा क्या है? This is one challenge. Tomorrow you have to save thousands of people's lives, right, doctor? Now, what you can see here is a Brenner's tumor with the urothelial epithelium, and it is often found along with the other ovarian pathologies like benign cystic teratoma is what you have to remember. Now, doctor, a patient has a sudden onset of the right-sided chest pain, absent breath sounds. What do you see here? Here you can see the bronchovascular markings, whereas here it is completely empty lung, that is the air in the pleural cavity, and all the lung is compressed over here. All the lung is compressed over here, which is classical of pneumothorax, is what you need to remember. Now, a patient with a history of low-grade fever past 4 weeks, ESR 120, and a chest X-ray is being shown to you. So this is an example of a miliary tuberculosis. If the TB is in the options, TB is the answer. That is as simple as that. याद रखना, अगर TB options में है तो blindly वही आंसर करो, TB पिकअप करो, वही हो जाता आंसर. 54-year-old man with a history of alcoholism, 2-week history of fever, productive cough, foul-smelling sputum, left-sided chest pain, chest X-ray is showing typically a air fluid level, which is very typical of a lung abscess, foul-smelling sputum, right? So whenever lung abscess is there, for 6 to 8 weeks, you need to give antibiotics to treat the lung abscess, is what you should remember. Very nice to see 10 online classmates. 45-year-old women, recent history of prolonged bed rest after surgery, presents with sudden onset of the shortness of breath with chest pain that worsens because of the pleuritic component. So what do you see here? Here all the pulmonary vessels are there. Here there is a paucity of the vessels because of the pulmonary embolism classically is what you need to remember. Such a kind of a focal oligemia, decreased blood flow, is a classical feature. So, which is called Westermarck sign in pulmonary embolism is what you have to remember. A patient has a painless enlarged cervical lymph node and a biopsy has been done. So what is this, doctor? This is a Hodgkin's lymphoma with lymphocyte predominance is what you are able to see histologically. Once more, what do you see in this? Popcorn cells due to irregular lobulated nuclei. This is lymphocyte predominant type is what you are able to see here. Now, a 60-year-old man with a history of smoking, recent diagnosis of carcinoma bronchus, pain and swelling in his wrists and clubbing in his fingers. And what you can see here, doctor, typically proliferation of the bone, hypertrophic osteoarthropathy, which is the feature which you see in the case of the bronchogenic carcinoma is what you need to remember. Now, a newborn has respiratory distress. A chest radiograph has been done. So what you can see, the intestinal gas shadow has gone into the thorax, which is very classical feature of the Bogdalak hernia. The Bogdalak hernia, whenever there is any defect in the posterior part of the diaphragm, not anterior, posterior part of the diaphragm, the abdominal contents, the colon will move into the thorax is called the Bogdalak's hernia is what you should remember. A patient presents with the intermittent abdominal bloating. There was a large multicystic mass identified in the ovary, multicystic mass, along with you are being shown the histology. So it is a mucinous material typically lined with columnar epithelial cells which are producing the mucus, which is characteristic of mucinous cystadenoma of the ovary is the diagnosis. Invariably, one MCQ will come in the tomorrow's NEETPG. Doctor? Very good question. Kadir Basha has asked, sir, is not the panda's eye and raccoon's eye sign are not the same? In fact, that was what while composing the MCQ, I thought there can be a little conflict in the options with two answers. Yeah, very much, very much. You're right, doctor. Now, a 50-year-old alcohol abuse presents with acute vomiting of the blood and lightheadedness. He has a history of being treated with for liver cirrhosis. A barium study, what do you see here, doctor? There are the filling gaps in barium which are due to the esophageal varices. Kadir Basha, you are absolutely right in that particular point, right? So, esophageal varices with the cirrhosis of liver. 55-year-old, severe chest pain, difficulty swallowing that worsens after the meals. The barium swallow is being shown to you. So this is how the stomach has herniated. It's called as the paraesophageal hiatus hernia is what you need to remember. A patient undergoes a barium swallow study for the evaluation of dysphagia. He has a history of tuberculosis. So what do you see here? Esophageal diverticulum in the mid-esophagus, which is a sac-like protrusion. So past history of the tuberculosis. So mid-esophageal diverticula are generally the traction diverticula, because TB is involving the adjacent lymph nodes that have become fibrotic, and that post-inflammatory fibrosis of the surrounding mediastinal tissues will lead to a traction diverticulum in the mid-esophagus is what you need to remember. So TB histoplasmosis can also lead to mid-esophageal diverticulum. 68-year-old, increasing shortness of breath, ankle swelling, and fatigue. Chest X-ray is being shown. Chest X-ray. So what is the most likely diagnosis, doctor? The chest X-ray has been shown. So these are the symptoms of the shortness of breath, ankle swelling, fatigue, with enlarged heart, enlarged pulmonary veins, which are all indicative of cardiac failure is what you need to remember. A 60-year-old with a history of cancer presents with the shortness of breath with a low BP. Chest radiograph is showing a typical water bottle-like appearance, which is the feature of pericardial effusion. A woman who has a incidental finding during the pelvic ultrasound that shows a complex ovarian cyst containing calcification and echos, and all that echos are because of the hair and teeth-like structures, which is classical of a mature cystic teratoma. Dermoid cyst is what you need to remember. Right? A 32-year-old woman with resistant hypertension, episodic flank pain, a beaded appearance on the renal angiography is very classical of it also is very classical of fibromuscular dysplasia, which is showing string of beads appearance. जैसे जपमाला होता है, जैसे जपमाला एक योगी का जपमाला होता है, string of beads appearance is what you need to remember. Now, doctor, the next question. A pregnant woman presents with a severe pain and swelling in her left leg, which appears to be pale. That's what you're able to see here. So the past history of DVT. So it is severe pain, swelling, initial pallor of the limb in a pregnant woman with a history of DVT is called phlegmasia albadolens. Phlegmasia albadolens is what you need to remember. Right, doctor? Now, that completes almost 39 image-based questions in this mock test, doctor. I would like to listen how was your scores, right, in the test number 12. Now, doctor, let's run through the non-image based questions very fast. Newborn, right arm hanging by the side, erected, internally rotated, which is Erb's Duchenne palsy involving C5C6. Biceps, deltoid, infraspinatus, supraspinatus, they're all involved. C5C6. But triceps is C7CA. That's the reason it will be spared in the Erb's palsy is what you have to remember. A 14-year-old girl, hyperacusis, difficulty hearing low-pitched sounds following a surgical dissection of a AV malformation near her ear. So basically, it's called hyperacusis. The tensor tympani is innervated by the branch of the trigeminal, specifically the mandibular division, And that muscle reacts to the loud noises by contracting, which dampens the vibrations of the tympanic membrane, and that lead to the development of the hyperacusis, right? So now, doctor, a 36-year-old wants to have vasectomy, and there's a cutting of a structure. Which structure do you cut? Ductus deferens is the one which is cut during vasectomy. 31-year-old want to sequence the exact order of nucleotides, which is done through polymerase chain reaction that amplifies DNA sequences. Sweet odor is characteristic of maple syrup urine disease. Elevated branched chain alpha keto acids in the urine are diagnostic of maple syrup urine disease. Hypertonia is a common neurological feature of maple syrup urine disease. Patient has dermatitis, diarrhea, dementia, which is pellagra, is what you should know. It is the histamine 1 receptor activation that lead to the classic allergic reactions. Pruritus and bronchoconstriction is what you should remember. The patient has hyperactivity and absence of corneal clouding suggests the Hurler or Mercure. Pearly papillar skin lesions and clear corneas are indicative of Hunter's syndrome. So hyperactivity, clear cornea means it is not Hurler, it is not Mercure. Both of them have corneal clouding, whereas Hunter don't have. Hunter don't have corneal clouding. It has a clear cornea. Unless your cornea is clear, you can't hunt. Easy to remember. Pearly papillar skin lesions and clear corneas is equal to Hunter. Iduronate 2-sulfatase deficiency is Hunter syndrome. Now, doctor, bacteria lysed in supernatant is treated with a non-specific ribonuclease. So whenever you treat RNA with ribonuclease, rRNA, ribosomal RNA has the greatest stability, whereas mRNA is linear, single-stranded, easily degraded. Smaller RNAs like miRNA, siRNA are also likely to be degraded by the ribonuclease is what you should remember. So once more, doctor, you should know everything about the ribonuclease activity, different RNA types, RNA stability, enzyme specificity, everything. I leave the literature for you. 23-year-old muscle cramps, burgundy colored urine after exercise, high levels of ammonia without increase in lactate, all suggestive of McArdle's disease, which is type 5 glycogen storage disorder, where you have the muscle phosphorylase myophosphorylase deficiency. Once more, doctor, all the glycogen storage disorder, Hirsch disease, liver phosphorylase, presents with hepatomegaly. Curie or Forb disease, debranching enzyme, hypoglycemia, muscle weakness. Pompe disease, lysosomal alpha glucosidase deficiency with hypotonia and muscle weakness. McArdle is myophosphorylase, exercise-induced muscle cramps and myoglobinuria. Phosphoglycerate kinase deficiency has hemolytic anemia and CNS dysfunction. So be very sure, doctor, all these are crammable items which you need to cram for the exam. 14-year-old boy, muscle weakness, enlarged calf muscle, family history of similar symptoms in the maternal uncle. Muscle fiber degeneration, that is either Becker or Duchenne. Both of them are X-linked recessive disorders. Jerky eye movements is nystagmus, confusion. These are classic of Wernicke encephalopathy, vitamin B1 deficiency. During the growth of a child, arginine becomes an essential amino acid in a growing child. Here, 3-year-old boy with recurrent infection, negative nitroblue tetrazolium dye reduction test is equal to chronic granulomatous disease, where there are recurrent infections with catalase positive organisms is what you have to remember. 3-year-old boy, once more the same question repeated. 44-year-old DR4, HLA DR4 positive. So there are erosions characteristic of rheumatoid arthritis. So typically it is HLA DR4 positivity supports the diagnosis. There is vitiligo. What is vitiligo? It is an autoimmune destruction of the melanocytes. There is a hypocalcemia, history of infections, deletion of chromosome 22 means DiGeorge syndrome. So in DiGeorge syndrome, there is thymic aplasia. The follicle of the cortex of the lymph node is primarily involved in the B cell lymphocyte maturation. And the follicle of the cortex of the lymph node is affected in thymic aplasia, which is seen in the case of the DiGeorge syndrome, is what you have to remember. Now, 17-year-old, features of rheumatic fever. Which molecular structure is very important for presenting streptococcal antigen to the T cells? So MHC class 2 molecules are composed of 2 alpha, 2 beta chains. They present the exogenous antigens to the CD4 plus T cells is what you need to remember. Acute allograft rejection. Which T cell surface molecule is the target for the monoclonal antibody to prevent the immune-mediated graft rejection? Beautiful question. CD3 is part of the T cell receptor complex, which is needed for the T cell activation. So monoclonal antibody against the CD3 is the one which will prevent the graft rejection, is what you need to remember. CD3 T cell receptor complex signaling. CD4 is a co-receptor for MHC class 2 found on helper T cells. CD14 is a marker of macrophages. CD16 is found on the natural killer cells and mediates the antibody-dependent cellular cytotoxicity, ADCC, is what you should remember. A peripheral helper T cell lymphocyte engages in the antigen-presenting cell but only receives signal 1. What is the likely outcome for this T cell without the necessary co-stimulatory signal? That lead to anergy. Without co-stimulations, T cells become anergic. That means they are unable to respond upon re-encounter with the antigen, is what you need to remember. So I'll leave the literature for you. Signal 1 is T cell receptor recognition of the peptide MHC complex. Signal 2, co-stimulatory signal typically via CD28 on T cells binding with the B7 on the antigen presenting cells. So you have to master this, doctor. I have discussed all this funda and made available on the SCORE learning app in the video library, and also microbiology mind maps I created and made available on the learnograph.com. Today only, go buy it, download it, microbiology, snapshots, mind maps, where all these funda are being presented. All right, doc? Now, 42-year-old women with joint pain, morning stiffness, rheumatoid factor, what is it? It is the FC portion of the IgG. Anti-IgG is the rheumatoid factor. So it is the FC portion of the IgG molecule is what you need to remember. right? So anti-IgG antibodies, it is the IgM type of antibody which is against the IgG, men against girls. Now, 67-year-old cancer survivor, natural killer cells. So typically, all the tumor surveillance is because of the NK cells. NK cells, just like CD8 plus cytotoxic T lymphocytes, they use the granules that have perforins, granzymes that induce the apoptosis in abnormal cells is what you should remember. So NK cells is one topic, doctor. Apoptosis, different pathways of apoptosis. Everything you should be ready for the tomorrow's NEETPG exam. I hope you are all having the 1100 high yield topic list I gave to you. If you don't have, please request, I'll provide you the PDF of 1130 topics from which 200 MCQs, 100% shoot shot to come. Right? Now, 22-year-old marathon runner, he has got a prolonged PR interval followed by non-conducted P wave. That's called Wenke-Back phenomena, Mobitz type 1 AV block. It is a very benign finding in athletes because of the high vagal tone. 52-year-old women, chronic hand pain, stiffness. So X-ray shows joint space narrowing, subchondral stenosis. All is indicative of osteoarthritis. She need to do stretching, strengthening exercises, only topically used NSAIDs. Very important. Now, 30-year-old, recurrent intrusive thoughts of leaving the doors unlocked. It is called OCD. SSRIs and cognitive behavioral therapy is the mainstay of therapy of obsessive compulsive disorder. So, 45-year-old patient acknowledges the need for change but not yet decided on a specific plan that indicate ambivalence. So ambivalence is typically found in contemplation stage. If he has not yet acknowledged the need for change, it is called pre-contemplation stage. Then comes preparation stage, then comes the action stage. So many stages are there in our change. Always the only constant thing in our life is change. You are preparing for entrance also. Pre-contemplation, contemplation, preparation and action, right? So I hope you all reached the stage of preparation, finishing pre-contemplation and contemplation stage of life. 43-year-old construction worker. Positive drop arm sign suggests rotator cuff tear. MRI is very sensitive for soft tissue injuries around the shoulder. So I leave the literature for you. Rotator cuff impingement or tendinopathy and rotator cuff tear. They are the two things. So both will have abduction, external rotation predominantly involved. Rotator cuff tear and rotator cuff impingement. 25-year-old women, 2-week history of severe itching. So whenever there is scabies, topical permethrin is the treatment of choice. 62-year-old women, high intensity statin therapy presents with muscle pain and weakness. So then you try to go to moderate intensity statin therapy and then recheck. And what are the alternatives to the statins, doctor? Ezetimibe and PCSK9, PCSK9 inhibitors. They are the alternate therapy for those who cannot tolerate the statins is what you need to remember. Once more, hypolipidemic drugs is a very hot topic for the tomorrow's NEET PG examiner, doctor. Now, 67-year-old woman, 2-year history, painless swollen lymph nodes in the neck, night sweats, mobile non-tender cervical axillary lymphadenopathy. So it is all consistent with follicular lymphoma, which is an indolent non-Hodgkin's lymphoma. It is the 14-18 translocation with the overexpression of the BCL2 gene, which you see in case of the follicular lymphoma. Now, 55-year-old. So, always, whenever you are evaluating hypertensive patient, don't forget hypertension, diabetes, they both are like the twin sisters. You screen for the diabetes with HbA1c is an essential part. A 58-year-old male comes to the clinic, ruddy complexion, itching, pruritus, splenomegaly, elevated hematocrit, that is all polycythemia rubra vera, which is a myeloproliferative disorder. And what kind of pruritus it is called? Aquagenic pruritus in polycythemia rubra. Whenever he takes a hot shower, the basophils, which are excessively producing histamine, release that and lead to the pruritus, which is called aquagenic pruritus, is the feature of polycythemia rubra vera, is what you need to remember. 30-year-old, 2-month history of intermittent ear pain, worsening on chewing. So, temporomandibular joint tenderness with nocturnal bruxism is suggestive of temporomandibular joint disorder. 45-year-old male with a history of alcohol, hospitalized for pneumonia. He has malnutrition. And all these symptoms, that is diffuse weakness, decreased tendon reflexes, low phosphate in magnesium, that all suggests the refeeding syndrome. Refeeding syndrome. So whenever there is any malnutrition, chronic alcohol usage, along with hypophosphatemia, once you start refeeding, there is an increased insulin secretion that will shift the electrolytes intracellularly like potassium, leading to hypokalemia. There's a lot of phosphate utilization because of the glycolysis that lead to muscle weakness, rhabdomyolysis, arrhythmias, and seizures in refeeding syndrome. A 15-year-old boy with colorectal cancer. Several relatives have been diagnosed with that. So there's a possibility of hereditary syndrome like familial adenomatous polyposis. You need to do annual sigmoidoscopy starting at the age of 10 to 12. 68-year-old advanced metastatic cancer with a limited prognosis. Initiate a hospice care focusing on symptom management and giving the support. 19-year-old college student, difficulty falling asleep before 2 a.m. and improved sleep quality on weekends, suggests delayed sleep-wake phase disorder. Delayed sleep-wake phase disorder. It's called DSWPD. So I leave the literature for you about it. So typically occupational history and the worsening of the symptoms after the corticosteroid therapy is consistent with a fungal infection because of the immunosuppression, that is histoplasmosis. 58-year-old, 5-year history of type 2 diabetes. So whenever there is albuminuria with diabetic nephropathy, you need to start ACE inhibitor is the treatment of choice in diabetic nephropathy. 37-year-old weight loss, intermittent shaking of her hands. So typically it is a cardiovascular features of the thyrotoxicosis is what you have to remember. Now, painless oral ulcer, joint pain, intermittent rash on the cheeks, anemia, low platelet, low WBC, ANA positivity, it is all equal to SLE. Now, there is a needle stick injury. So, 3-drug antiretroviral regime post-exposure prophylaxis need to be started immediately. High fever, sharp pleuritic chest pain, rust-colored sputum, they're all classical of the community-acquired pneumonia caused by the Streptococcus pneumoniae. The patient's age, smoking history, rapid symptom onset, weight loss, all these suggest you of esophageal cancer. Perform an endoscopy to know the esophageal malignancy. 21-year-old neonate brought to emergency. Fever, irritability, poor feeding, bulging fontanella suggests meningitis. Due to neonatal sepsis, obtain blood, urine and CSF culture and start empiric antibiotic. Once more, doctor, I leave the literature to you in one single snapshot. Neonatal sepsis caused by group B Streptococcus E. coli listeria. Ampicillin, gentamicin is the mainstay of the treatment, is what you should remember. A 6-month-old infant, 2-month history of inspiratory stridor, worse when the child is excited or crying and improves when the child is lying on their stomach. So chronicity of the stridor, lack of any infectious symptoms and skin changes, they all suggest hemangioma. Stridor that improves in the prone positions typical for laryngomalacia. But in this child, additionally, there is a skin discoloration. Points towards the hemangioma. That's the differential. Now, you're doing a CPR. Capnography shows end-tidal CO2 reading that gradually decreases from 35 to 10 over 15-minute period. So what is the cause? A gradual decrease in end-tidal CO2 during CPR suggests a decrease in the effectiveness of the chest compressions, is what you have to remember. Now, the patient, typically it's called as bispectral index score. Between 60 to 40 suggests he is under surgical anesthesia. More than 85 indicate patient is awake or slightly sedated. And a bispectral index score less than 40 indicate deep level of anesthesia, suggestive of burst suppression. So you should know, how do you monitor the depth of anesthesia? Using the bispectral index, everything, anything about it, you need to be ready for the tomorrow's NEETPG exam, doctor. Once more, I am telling you, 100% strike rate in the tomorrow's NEETPG. Ditto, same questions will come in the exam. So be prepared to solve all the 50 full-scale NEETPG mock tests. Please go to learnograph.com, download the PDF. Each PDF ebook is around 500 rupees. But 50 PDFs will cost you 25,000 bucks. But you can call our helpline and 9000-868-356, right? And for 10,000 rupees, you get all the 50 full-scale mock tests along with the PDFs for you to download. You can share it with about 20-30 friends together, can buy and sit together and study, discuss the question paper. Every NEETPG mock test has 40 to 50 image-based questions, clinical minute-based questions, There is a 1130 high-yield topic list PDF. Freely, I will provide it to you. If you don't have, please WhatsApp today only to the number I gave, our helpline number, and I'll send it. So, but most important, कहीं भी coaching लो, वो ऐप हो, face-to-face coaching classes हो, कुछ भी हो, but take the 50 NEETPG full-scale mock test and attend the discussion, solve the paper religiously. Once you solve this 50 full-scale NEETPG mock test, 10,000 MCQs, and every test is followed by 200 mind maps in that PDF ebook. And those mind maps consolidate all the important points about that particular topic. So that way, parallelly you are finishing revision. How to consolidate preparation, how to focus and read only the things that the examiner is going to short ask you in the tomorrow's exam. That is the secret of winning. It's not about how many books we read, how many coaching programs we attended, how many videos we have seen. That's all complete bullshit, right? You don't need more than 200, 300 hours of serious sitting with Dr. Murli Bharadwaj to become the topper doctor. I vouch for you. Last 25 years, 3 lakh medical students through this YouTube channel, I got opportunity to mentor, inspire them with many MCQ discussions, mock test discussions, right? Way back when I myself started the coaching and also preparing for entrance, there were no coaching programs, right? I was the first to start in South India. So that time in the first 197 ranks came. I got the first place and then joined MD General Medicine at NIMS. So what I'm trying to tell you is coaching or anything you need to, the purpose is to stimulate you, bring a focus in your preparation, bring a practice every day. 200-300 hours is more than enough if you are reading the right material, let me tell you. All right, doctor. So let us solve 10 more questions, but all 200 questions, don't forget to solve it in the PDF. You're doing a surgical procedure. Color of the CO2 absorbent granules in the soda lime canister has changed from white to purple. What does it indicate? It indicates the presence of the ethyl violet, that the CO2 absorbent capacity is exhausted, is what you need to remember. So CO2 absorbance and the color indicators के बारे में ये MCQ mind map बनाया है. 70-year-old scheduled for hip replacement. So whenever you do epidural anesthesia, you need to do a test dose to confirm proper catheter placement, unlike spinal anesthesia. Spinal anesthesia uses lower volumes of anesthetic compared to epidural, is what you need to remember. Ether is associated with increased salivation and respiratory secretions. So inhalational anesthetic agents and ether. Halothane cause biphasic pattern of EEG. Isoflurane cause isoelectric EEG. Desflurane, sevoflurane lead to burst suppression in high doses. So all this funda, anesthesia mein full marks maar ke aana, right? Pediatric anesthesiologist preparing to intubate a 3-year-old child with the history of asthma. Rocuronium is favored because of the rapid onset, making it suitable for intubation, which is essential in pediatric anesthesia. Vecuronium, rocuronium, pancuronium, picuronium, long-acting steroid analog of pancuronium को कहते हैं. Picuronium is what you need to remember. 50-year-old, chronic renal failure, short diagnostic procedure. Which opioid is best? Remifentanil is ultra short acting. metabolized by the plasma esterases, suitable in renal impairment. You need to be very sure. Morphine, fentanyl, alfentanil, sufentanil, remifentanil. 1-2 points about each of them. So, doctor, mind maps is the fastest way by which you can be able to do the revision for the tomorrow's NEETPG. 32-year-old female, history of DVT on warfarin therapy, comes to emergency, INR is significantly elevated. So fresh frozen plasma contain all the clotting factors and used for a urgent reversal of the warfarin therapy. 16-year-old non-blanching red purple spot suggests purpura, recent sore throat, no drug allergy, indicate Henoch-Condin's purpura is what you need to remember. So macule, papule, nodule, vesicle, bulla, pustule, wheal, and purpura. So this dermatological language of the primary skin lesions, you have to be very, very sure for the tomorrow's NEETPG exam. A dermatopathologist is reviewing a skin biopsy. Multiple scaly erythematous patches on the sun-exposed area. Premature keratinization in the lower epidermis. Acantholytic cells with a perinuclear halo in the basal epidermis, which is classical of Bowen's disease, which is squamous cell carcinoma in situ, is what you have to remember. A 35-year-old, well-demarcated reddish-orange flocks on the body, notable islands of sparing. Palms and soles have thickened skin, orange hue, and history of controlled HIV infection. Reddish-orange perifollicular papules with islands of sparing, palmopanther, keratoderma. They're all indicative of pityriasis rubra pilaris, right? So this type of PRP is associated with HIV is what you need to remember. So what is that called as? Nutmeg greater appearance. Reddish orange perifollicular papules with a nutmeg greater appearance is the feature seen in pityriasis rubra pilaris. Now, doctor, 17-year-old female, patches of hair loss. These patches vary in size that they sometimes find her hair in clumps around the house. So she's stressed out. Trichotillomania, which is compulsive urge to pull out one's hair, is called trichotillomania. 63-year-old HIV, painful unilateral vesicular rash. Left forehead does not cross the midline. So this patient has herpes zoster ophthalmicus, especially when Hutchinson's pupil is present, is at increased risk of stroke in the subsequent year, is what you need to basically remember. Now, anesthesiologist is monitoring a patient who is undergoing craniotomy. End-tidal CO2 has been stable but suddenly begins to rise. The patient's temperature is increasing rapidly. Classical of malignant hyperpyrexia is what you need to remember. So, one of the early clues to the development of malignant hyperpyrexia is EtCO2. EtCO2 elevation is a very important clue, is what you need to remember. So, doctor, with this, we come to the conclusion today. We read every day. Before we sleep, we pray the God to give us the strength, because we are born to become great physicians, cardiologists, neurologists, neurosurgeons, cardiologists, cardiothoracic surgeons, ophthalmologists, to save millions of the God's creation, the human race. So God created you with a purpose. So let's thank the God, pray the God to give the strength for the upcoming NEETPG exam. and always aim high, think big, and think positively. By my next 50 days, अच्छा पढ़ूंगा. डॉक्टर मुरली भारद्वाज का 50 फुल स्केल मॉक टेस्ट का 10,000 MCQs को खत्म कर दूंगा और पूरा मजबूती के साथ I'll go and win the tomorrow's NEETPG exam. Good night. And every day we meet. This is Dr. Murli Bharadwaj, your classmate, roommate, benchmate, tablemate, studymate. Always for you. Good night.